Honorable Chairperson, it's my honor and privilege to join you in this very important annual meeting of the SADC Ministerial Committee on Health for 2024. As SADC Secretariat, we acknowledge the multiple health challenges our region continues to face while our health systems recover from the devastating effects of the COVID-19 pandemic. This is the third time the Health Ministerial Committee meets during the course of this year, 2024. Two of the three meetings were emergency meetings, convened urgently to find solutions to health emergencies, namely cholera in January 2024 and Mpox in September 2024. This is a testimony of your commitment to responding to the health challenges in the region. As you are all aware, member states continue to face multiple and concurrent epidemics such as cholera, Mpox, measles, and the threat of Marburg virus disease recently, and at the same time, the clock towards 2030 is continuously ticking, reminding us about the commitments we have made to end TB, HIV, and malaria as part of the SDG targets. In this year, 2024, the region has also been affected by El Nino-induced droughts and flooding in a number of member states, exposing our population to food insecurity and malnutrition, especially in children, as well as waterborne diseases such as cholera. Recently, our region has again been affected by another epidemic, Mpox, which led WHO and the Africa SADC to declare a public health emergency of international concern and public health emergency of continental security, respectively. While the DRC is the most affected region, we must also acknowledge the solidarity expressed by other member states and the support provided by Africa CDC, WHO, and UNICEF in effort to curb the epidemic and ensure health safety for the people of the DRC. Post-COVID-19, we are seeing encouraging trends for many of our member states in terms of support to national health programs such as malaria, tuberculosis, health infrastructure, health information system, as well as in strengthening human resources for health. At the just ending high-level meetings at the United Nations General Assembly in September this year, all SADC member states renewed their commitment to continue to work towards the achievement of the universal health coverage, the end TB targets, and to strengthen their pandemic prevention, preparedness, and response capacity. Honorable Chairperson, let me also take the opportunity to underscore the importance for member states in actively participating in the process of the development and ratification of the pandemic treaty, as well as the revision of the international health regulations. These instruments are crucial as they will not only define our collective and individual capacity to prepare for the next pandemic, but will also support our efforts in building resilient and sustainable health systems. Lessons from the last pandemic show us that while these commitments are a step in the right direction, the challenges that affect our health systems in the region are still immense and deep-rooted in the underinvestment in health of the past couple of decades. I, therefore, urge member states to take steps towards local and regional manufacturing to ensure a sustained response to health and health security for the region. This will ensure that the region has adequate commodities, medicines, and vaccines to be able to respond to its own health needs. In tandem, we should actively advance the effort we are making towards implementing the SADC pool procurement services, in short SPPS, in particular the establishment of the special purpose vehicle for SPPS, which is on the agenda of your meeting today. Honorable Chairperson, in this meeting today, we will also receive a report on the general state of health in the region with focus on major public health issues, including tuberculosis, malaria, nutrition, and HIV, SRHR, among others. While we note with satisfaction a consistent improvement in most of the TB indicators in the communities, the situation of TB in the mining sector and drug-resistant TB remains a major concern in member states with large-scale mining and those with wide networks of small and artisanal mining activities. This year, the team's project is closing, and we must recognize the achievements and milestones the region has made through the project, such as the establishment and rollout CBRS, the establishment of occupational health centers that constitute the backbone of TB management across the region to ensure the continuity of care for mobile populations. We have worked with the ECSA health community, the Global Fund, and other partners, and we do need to find ways to mobilize additional resources to consolidate and sustain this ongoing effort. On the malaria front, the region has seen the national programs recovering from the COVID-19 pandemic with a reduction in the number of malaria-related deaths, which we have witnessed. However, we are currently facing a huge task to ensure the continuity of the Elimination Aid Initiative, which has played a critical role in advancing malaria elimination for over a decade. It's therefore my hope and belief that the ministers in this meeting today will lead us in a direction where we can find solutions to sustaining the work of the E8. And as we all attest, the work of E8 has placed the region on a positive path towards malaria elimination and has been our SADC flagship malaria program over the years. Honorable Chairperson, the region continues to make positive steps in the HIV response. The number of new infections and the AIDS-related deaths in 2023 decreased by 57% and 52% respectively. However, to reach the last mile, it's important to invest more in the response, to understand the key drivers of the epidemic and implement targeted and accelerated intervention in order to reduce inequities, improve access to health and HIV services for key and marginalized populations. Our HIV interventions should also integrate SRHR, comprehensive sexuality education for better outcomes, where we can leverage on joint resourcing and delivery of programs that are comprehensively integrated. Honorable Chairperson, an estimated 21 million children under 5 years old in 2024 are stunted in our region. This is an increase from 18.6 million, which was reported in 2022. The problem of stunting is attributed to poor child feeding practices and limited access for a diverse nutrition diet at household level. Stunting poses severe lifelong and intergenerational consequences that have lasting negative effects on future health and development. Such poor indicators have a negative impact on children's cognitive development and leads to poor educational outcomes, among others.